Receptive aphasia, also known as Wernicke unregistered trademark S aphasia, fluent aphasia, or sensory aphasia, is a type of aphasia traditionally associated with neurological damage to Wernicke unregistered trademark S area in the brain. However, the key deficits of receptive aphasia do not come from damage to a NICS area. Instead, most of the core difficulties are proposed to come from damage to the medial temporal lobe and underlying white matter. Damage in this area not only destroys local language regions but also cuts off most of the occipital, temporal, and parietal regions from the core language region. People with receptive aphasia are unable to understand language in its written or spoken form, and even though they can speak with normal grammar, syntax, rate, and intonation, they cannot express themselves meaningfully using language. Receptive aphasia is not to be confused with the Nick-Korsakoff syndrome. Presentation: when we want to speak, we formulate what we are going to say in Wernicke unregistered trademark S area, which then transmits our plan of speech to Broca unregistered trademark S area, where the plan of speech is carried out. Wernicke unregistered trademark S area is located posterior to the lateral sulcus, typically in the left hemisphere, between the visual, auditory, and synesthetic areas of the cerebral cortex. A person with this aphasia speaks normally but uses random or invented words. Leaves out keywords. Substitutes words or verb tenses, pronouns, or prepositions. And utters sentences that do not make sense. They have normal sentence length and intonation but without true meaning. They can also have a tendency to talk excessively. A person with this aphasia cannot understand the spoken words of others or read written words. Speech is preserved, but language content is incorrect. Substitutions of one word for another are common. Comprehension and repetition are poor. Patients who recover from Wernicke unregistered trademark S aphasia report that, while aphasic, they found the speech of others to be unintelligible. And, despite being cognizant of the fact that they were speaking, they could neither stop themselves nor understand their own words. The ability to understand and repeat songs is usually unaffected, as these are processed by the opposite hemisphere. Patients also generally have no trouble purposefully reciting anything they have memorized. The ability to utter profanity is also left unaffected, however the patient typically has no control over it, and may not even understand their own profanity. Damage to the posterior portion of the left hemisphere unregistered trademark S superior and middle temporal lobe or gyrus and the temporoparietal cortex can produce a lesion to Wernicke unregistered trademark S area and may cause fluent aphasia, or Wernicke unregistered trademark S aphasia. If Wernicke unregistered trademark S area is damaged in the non-dominant hemisphere, the syndrome resulting will be sensory dysprosidia the inability to perceive the pitch, rhythm, and emotional tone of speech. Patients who communicated using sign language before the onset of the aphasia experience analogous symptoms. Luria's theory: Luria proposed that this type of aphasia has three characteristics. 1. A deficit in the categorization of sounds. In order to hear and understand what is said, one must be able to recognize the different sounds of spoken language. For example, hearing the difference between bad and bed is easy for native English speakers. The Dutch language, however, makes a much greater difference in pronunciation between these vowels, and therefore the Dutch have difficulties hearing the difference between them in English pronunciation. This problem is exactly what patients with Wernicke unregistered trademark S aphasia have in their own language. They can't isolate significant sound characteristics and classify them into known meaningful systems. 2. A defect in speech. A patient with an X aphasia can and may speak a great deal, but he or she confuses sound characteristics, producing a word salad in extreme cases, intelligible words that appear to be strung together randomly. 3. An impairment in writing. A person who cannot discern sounds cannot be expected to write. See also, aphasia, expressive aphasia, schizophasia, conduction aphasia, logorrhea, agraphia, paragrammatism, transcortical sensory aphasia. References. Further reading, Klein, Stephen B., and Thorne. Biological Psychology. New York, Worth, 2007. Print. Saladin, Kenneth S. Anatomy and Physiology, The Unity of Form and Function. New York, McGraw-Hill Higher Education, 2010. Print. External links, Aphasia Center of California in Oakland, California, U.S.